Amid a wave of opposition, 15 Chinese medical experts arrived in Nigeria on Wednesday to join the battle against COVID-19. The federal government received some medical equipment and supplies brought by medical team which arrived at the Nnamdi Azikiwe International Airport, Abuja, in a chartered Air Peace flight. China's Civil Engineering Construction Corporation (CCECC), the sponsor of the trip, said they brought about 16 tons of test kits, ventilators, disinfection machine, disposable medical masks, medications, rubber gloves, protective gowns, goggles, face shield, infrared thermometers, and others. Minister of Health Dr. Ç0CT0RS, who was at the airport to receive the Chinese and their supplies, said the team will be quarantined for 2 weeks. They knew that before they came and have undergone tests before they left their country. Nevertheless, they will be in quarantine for 14 days. The Nigerian Center for Disease Control (NCDC) has gone to see where they will be quarantined. Ehanire added, the equipment they brought will assist a lot to fill some existing gaps. We now have 50 more ventilators. Chinese ambassador to Nigeria, Zhou Pingjian, said equipment and medical supplies are valued at about $1.5 million added to the cost of the flight. Everything is worth about $2 million. Our reporter learned that 12 of the 15-man team are doctors. The rest are specialists in infectious diseases, respiratory illness, intensive care, cardiology, neurology, general surgery, and anesthesiology. CCECC Nigeria Managing Director Michael Jiang said in a statement, the primary purpose of the working team is to escort the medical supply and provide guidance for their usage and distribution. They will also provide CCECC employees with critical and necessary healthcare assistance where necessary. They are also coming with adequate personal protection equipment and medical items for the employees. In addition, under the directive of the Chinese Embassy, and in response to the Nigeria government request, the working team may also share with Nigerian medical teams directive methods on how to contain the COVID-19 and provide advice on the use of relevant medical equipment. The team is not coming to treat COVID-19 patients in Nigeria. In keeping with its cooperative value, Stride with Nigeria, CCECC is participating in the construction of 2 COVID-19 response facilities in the FCT to free as part of its corporate social responsibilities. The facilities are a 196-bed at this day Dome Treatment Center in collaboration with Sahara Group and Arise News, and the 150-bed Idu Depot Treatment Center. The Nigerian Medical Association (NMA) and the National Association of Resident Doctors of Nigeria reiterated that the Chinese experts must not directly treat any Nigerian patients. They describe any attempt by this medical team to manage any Nigerian patients as unethical and illegal. NMA President Dr. Francis Faduduye told our reporter, our stand has not changed and we will insist that there is nothing the Chinese want to offer that can improve what we have on ground. There are so many things that we need to put into consideration because it is a war affecting ordinary Nigerians, and sometimes you look at the risk and benefits. Our members will look at what is on the ground. If we are doing what we are doing and the Chinese do not interfere with us, we will continue doing what we are doing for Nigerians. We cannot now precipitously make a decision. We are an association that is bounded by ethics and rules. In every short while, you will hear our decision. NARD President Dr. Shokomba Aliyu said while the association was not against donations, the experts cannot attend to any Nigerian patients because they do not have the license to practice in Nigeria. We do not need their hands as we are not overwhelmed and can take care of our patients. So far, they have also stated that they are not coming to attend to patients, so we cannot say categorically if their words are anything to go by. Why the officials have gone ahead to welcome these Chinese, we are hopeful that the Chinese will have nothing to do with our patients, because if they proceed to involve the Chinese in the management of our patients, we will just leave the patients for the Chinese to continue. As it is now, we are going to be watchful and wait for them to see how far they are engaging the Chinese and to what extent they are going to be managing our patients, Aliyu said. Also yesterday, the People's Democratic Party (PDP) asked Nigerians to hold President Muhammadu Buhari responsible should there be any upsurge in the rate COVID-19 infection and death following the arrival of the Chinese. The party said it was alarmed that the president ignored the protests by Nigerians and professional bodies, including NMA, and allowed the Chinese doctors to be brought in from the other hotbed of the plague. PDP, through its spokesman, Kola Ologdiyan, questioned the safety of kits and equipment from China, adding that it was concerned about scary reports of escalation of the scourge in certain countries, reportedly after the arrival of Chinese medical personnel. Our doctors and nurses have been on top of the situation with records of recoveries and fewer casualties, thus raising questions about the real intention of bringing in doctors from China. Nigerians are aware that since the index case was reported to date, our nation's COVID-19 data stands at 254 confirmed cases, out of which 44 have been successfully treated by our doctors, with 6 deaths, which reportedly had other underlying ailments, the party noted. The party charged Nigerians to be extra vigilant and asked the Presidential Task Force to outline the state and local government areas the Chinese doctors are expected to operate in for monitoring. Also, the United Labour Congress said while there is nothing wrong with seeking help, stakeholders should have been carried along. Its president, Comrade Joe Ajero, said in a statement, "We are surprised that the decision to bring in the Chinese medical experts was not fully discussed and agreed among the top medical practitioners and stakeholders in the nation. This is worrying. This will such Why would such a crucial decision be taken in secret without coordinate input from the critical stakeholders in the nation? The sector is a highly specialized area which requires that all times the inputs of the professionals in this sector to process the offer and agree on its mechanics and modalities. As we battle against COVID-19, we strongly believe that the nation's medical experts must be involved in, not allowed to be at the forefront of taking such crucial decisions. ULC urged the federal government to address Nigerians' fears, especially as it relates to coronavirus. The movement of the actualization of the sovereign state of Biafra also said it would resist any move to deploy Chinese medical team in Southeast and South-South. Its leaders, Ñ1Ç Namadu, said in a statement, "We shall resist any medical assistance from China. Medical doctors and other health workers in Southeast and South-South are capable and trained to handle every medical challenge professionally in those areas." So guys, you've heard it all different groups, talking about this. Of course, you can say, oh, maybe those ones, they might not know the implication of all of these things. They don't know the effect or the importance of these people coming from China and what have you. What is surprising to some of them, is that why is it that they just took this in secret, in a hurry and what have you. But one thing that is still important, that the Nigerian Medical Association too also, are in the same on the same page with the people, that these people ought not to have come in the first place. But we don't know why the federal government, hurriedly invited them. And let's see. And everybody has said, we know what is on ground. Our doctors are doing fantastically well. So since they know why they brought them, let's keep our finger crossed. Let's continue to see what will come out of the whole thing. Someone says they should go to Italy, Spain, UK, and USA, where the virus is killing people. Not here. We don't need them. Nobody should collect anything. Chinese are chasing our beloved brothers in their country, but we are receiving them in Nigeria. I don't just understand. Do a medical checkup for them. Check, maybe they are infected before they can start treating our people. No, they are not going to be treating according to what they said. And also, some people have been saying, oh, they should check the equipment, just like, okay, I think a PDP said that, check the equipment whether they are really okay. With all the news that we've been hearing all over the place concerning the equipment they always take to different countries, and at the end of the day they will test positive to this COVID-19. So guys, let us hear your opinion from the things that this group of people have said. But the more bottom line is that they are going to be in isolation for 14 days. Leave your comments below and let's have your take.